So this is Shiloh, and Shiloh has this problem that is not really a problem. He doesn't have a fever, he is not sick, he is well interactive with his mom and dad. He needs support, he doesn't need treatment. And this is Jerry's part, because while we started Xlear, and I say we, it was really Jerry, because Jerry was the one who said, what you're doing isn't working, when the doctors were trying to treat our granddaughter with antibiotics again and again and again.
This is our granddaughter. She was about 6 months old when this started with the Xlear. She is about 10 or 11 there, and that is not a good picture. It's when she was receiving a 4-H award. She's a horsewoman and a marksman. But at 3 months old, her mother put her into daycare so she could go back to teaching. And she immediately started to have ear infections and went through all the medical failures, which you mentioned, with the antibiotics and more antibiotics and more antibiotics. And by the time she was 6 months old, they were going to put tubes in her ears. Her father also had the same problem, ear infection after ear infection, and had tubes in his ears, and that was my oldest son. And so I felt a bit like a failure, you know, when he was little, and I certainly did not want that to happen to her, and had thought of kidnapping her and running away before they could do this horrible deed to her, because in the meantime I had been an educator for many, many years, and I was involved in special education and counseling. And you have a meeting once a year on these children that are in your special ed. Now, special ed is pregnant women, special ed is speech, special ed is severely mentally handicapped, special ed is physical disabilities, but special ed is also language and learning disabilities. And these are your really smart kids, but they don't learn, and they have social behavioral problems, and you wonder why. And I began to notice a common denominator over 20 years. They all had chronic ear infections. On and on and on and on. And I brought this to the attention of several doctors and educators, and was told that this was all in my imagination, that ear infections were a part of childhood. Get used to it. Then I heard of one doctor down in Dallas who thought there may be a connection. And I coerced a principal into giving me the money to go down and listen to the doctor. And at that time, she said, or she thought, that an ear infection caused the brain stem to atrophy. And that was as far as we got with that. Now we do know that it does cause many, many problems. If you can't hear, or if you hear muffled sounds part of the time and you hear clear sounds part of the time, and that it does affect the brain, it does affect language, not just language processing, but articulation, but language itself, and the auditory processing skills, as well as yesterday, and I hope all of you took notice of this very important thing about the dental arch. Also had experience with that and never knew where it came from. And the children have this high dental arch. Their teeth are horrible. It is very difficult to straighten the teeth. It is, and it costs a lot. And it's caused from a chronic stopped up nose. I found that fascinating. Now they have a name for this. It's written up and it's real in its literature, and it wasn't in my imagination. It's called POD, post-otitis auditory dysfunction. That's your educational definition. And your medical definition is CAPD, chronic auditory processing dysfunction. So I shared my concerns with Lon very forcefully, and he, that's a nice way to say it, he started doing some research with the Finnish studies, And he came home one day and he said, you know, if you chew 8 pieces of gum with xylitol in it, the finish had 40% reduction in ear infections. That was after they put it into the school and kept track of their caries, and then noticed this on the side. But we had the problem in that she had no teeth. And by the time she had teeth, we had already done a lot of damage. So the next day he went back to work and he got some saline solution and had the pharmacy compound it with xylitol, and we started spraying her nose at every diaper change, and her ear infections went away and she hasn't had any more. And so then he started using it in his practice and had the same results. So that's just a brief introduction of why we're here, or why we're here.
Jerry has since moved from school counseling into being a therapist, and she loves reality therapy. And reality therapy essentially says, if what you're doing is not working, do something else. And that's what she pulled on me when Heather had her 4th or 5th ear infection in as many months. And so I was prompted to find something else, and what I found was Matty Uhari's chewing gum study. And we put it together. The connection between, that Jerry didn't point out, the connection between chronic ear infections and learning problems is that middle ear infections take place behind the eardrum. This is where all the little bones are that transmit sound from the vibrating eardrum into the cochlea. And if there's fluid in that area, those sounds are muffled. They're not transmitted to the brain correctly. And so these kids can't hear phonemes, the sounds that make up our language, correctly. And so they don't understand language. And if they don't understand language, they wind up in special ed, which is where Jerry saw this connection. But it's an obvious connection when you realize the mechanism of sound production and sound transmission. And any fluid is going to dampen those vibrations in the middle ear. So keep the middle ear free. And the way to do that is keep your nose clean, because bacteria from the nose climb down the eustachian canal into the middle ear. Ear infections come from the back of the nose. Sinus infections from those same bacteria climb up into the ostia of the sinuses and cause sinus infections. If your nose is particularly dry, those bacteria can break off and get aspirated. Pneumonia starts from bacteria that first colonize the back of the nose. So keep your nose clean.